This is shocking. Over 1 in 4 people have fatty liver disease, including 6 million children. And a lot of people don't even know they have it. And because of poor diet and lifestyle, cases are only skyrocketing. Fatty liver disease is a big problem, and that's why you need to know the top 10 signs and symptoms that you could have fatty liver disease. But before we jump into it, you need to know what causes it. This is crucial because the liver is actually an amazing organ. It's the second biggest organ, and it's one of the few organs that can actually self-regenerate itself. So that's good news because it means even if you have fatty liver disease, you can actually reverse it pretty much fully, but only if you catch it early and you take the right steps. Our liver has a ton of important functions, from nutrient processing, helping us get the energy out of the food we eat, detoxifying our blood, getting all the nasty stuff out of the blood so it's not toxifying our bodies. It even helps regulate blood sugar and bile production, digesting fats from our diet, and it helps store nutrients, lots of different vitamins and different nutrients, and helps also release them when we need it. So if you haven't gotten the message, the liver is your best friend. Okay, maybe not your best friend, but one of your close friends, okay? Just so you know, the type of fatty liver disease that we are talking about today is called non-alcoholic fatty liver disease. There is, of course, a type of fatty liver disease that can be caused by alcohol. And of course, for that one, alcohol is the primary cause. But for non-alcoholic fatty liver disease, which we are covering today, the 2 main causes are obesity and poor diet. So risk factors are insulin resistance, diabetes, prediabetes, high cholesterol, high blood pressure. These are the things that are going to predispose you to developing fatty liver disease. So based on the name fatty liver disease, it basically means there is fat deposited around your liver. Now, this isn't because you're eating fat in your diet. It's actually a poor diet high in added sugars and processed foods, which often leads to insulin resistance. And then your body has this excess fat. And where does it put it? Well, lots of places, including the liver. The liver gets all this fat around it. And the key thing is, as this progresses, more fat is deposited, more inflammation causes the liver to enlarge, causes it to be more irritated. Eventually, it can progress and advance and start scarring, and you can get liver cirrhosis, which then predisposes you to liver cancer and lots of other issues. So that's why it is so important to catch this early and reverse it, because the damage can be severe and deadly. And as you can tell, a lot of these are lifestyle dependent. So if you make changes in your diet and changes in your lifestyle, you can prevent or even fully reverse fatty liver disease. But first, you need to know what to look out for. So let's jump into the 10 signs and symptoms that mean you could have fatty liver disease. And I should mention that unfortunately, there are a lot of people who don't know they have it because it can often present without any symptoms. Now, this is the worst because it's hard to identify things, but that's why I mentioned the risk factors. Then you should still have this on your radar and talk to your doctor about it. Fatty liver disease is sometimes called the silent liver disease because it can sometimes have no symptoms, so it's easy to miss. Or some of the symptoms are quite vague, hard to recognize, which is why I'm going to cover them in detail. So number 1 is one of the most common and early signs of fatty liver disease, and that is fatigue and lack of energy. Now, I feel like we're all tired these days, okay? We've been through a lot as a society, but if you're starting to develop even more fatigue, this can really impact your quality of life. Like, you just feel like the motor that you had inside you is just slowing down, not feeling like you have a lot of energy, even if you've gotten a lot of rest. This could be a key early sign. And of course, fatigue and lack of energy can have other causes. But if you have the risk factors I mentioned and you're feeling really tired, this should be on your radar. And that's because if the liver is diseased or even starting to become diseased, there can be a buildup of toxins in your body. Having those toxins is gonna wear you down. It's gonna make you feel tired. And also, like I mentioned, the liver is involved in energy production. It helps us get all the energy out of our nutrients and foods we eat. So if it's diseased, we're gonna have a tougher time getting energy out of our foods. So we have less energy for ourselves. So we have less energy for ourselves. So we're gonna feel tired. Number 2, abdominal pain or discomfort. So this will mainly be in the right upper area of your abdomen because that's where the liver is located. So with fatty liver disease, what happens is your liver becomes enlarged. So you're getting all this fat on the liver. It can start aggravating the organs around it as well. So then you can experience this pain in your abdomen. Number 3, abdominal swelling or distension. Now, the medical term for this is called ascites, and that basically means a fluid buildup in the abdominal cavity. So because you have this diseased liver with a bunch of fat accumulating in it, it becomes impaired, doesn't function properly, and that can cause this buildup of fluid. This is similar to if you've ever heard of edema or leg swelling. You can get a buildup of fluid and swelling in your legs. This is a similar concept, but it tends to happen in the abdomen for fatty liver disease. It's different than bloating because if you have bloating from just digestion issues or an improper diet, that tends to fluctuate more and might go away some days and different times of the day. Whereas ascites or abdominal swelling because of fatty liver disease, it can fluctuate a little bit, but in general, it will always be there once it starts. And likely it will continue getting worse if you don't address the issue. Number 4, nausea and loss of appetite. So having fatty liver disease, like I said, the liver is disturbed, it's not functioning properly, and you get all these toxins building up. And toxins just don't make you feel great. So you can feel nauseous because of that. That can also affect your appetite. Fatty liver disease can also affect your gut microbiome. So it can just cause dysregulation in the normal bacteria and gut microbiome that you should have. So it can cause digestive upset. Number 5, skin changes, including spider veins, increased bruising, and itchiness. So this is a key one to look out for. This includes something called spider angiomas, spider veins. They basically are like a cluster of blood vessels that you'll see on the surface, like the surface level of your skin, and they almost look like a spider web. That's kind of why they get their name. And you can also get itchiness. This does tend to be a later sign of fatty liver disease once it's started to progress, even into cirrhosis, which is like scarring of the liver. And that's because you have a buildup of toxins, because your body's just not coping with these toxins. Number 6, breast enlargement in men. The medical term for this that you might have heard is called gynecomastia. And this specifically tends to affect men. And that's because having a fatty liver or a diseased liver can just ruin your hormones. So it can dysregulate your hormones. Specifically, it can decrease testosterone and increase estrogen. And that imbalance can lead to breast development, especially in men, because men tend to have higher testosterone and lower estrogen. So number 7, dark urine. This can be a hallmark symptom of fatty liver disease. And that's because you may have heard of something called bilirubin. The liver is actually involved in breaking this down. Now, bilirubin is a pigment that results from red blood cell breakdown. It's actually interesting because your red blood cells don't last forever. They actually have a lifespan of about 120 days, and then they get broken down. And this pigment in bilirubin is in our body, and it needs to be processed and eliminated. So the liver has a key function in that. But if your liver is dysfunctional, what happens is the bilirubin, that pigment, which is kind of this yellowy pigment, well, this can start accumulating in your body and it can be excreted in your urine, meaning it can make your urine a darker color. Specifically, if it's this dark, really amber color, you might want to bring that to the attention of your doctor. Number 8, along the same lines, pale or clay-colored stool. Now, your body has something called bile, and bile is actually what gives our stool that brown color. But if you have a diseased liver, bile is not properly excreted. So as a result, you get this pale, clay-colored stool rather than the typical brown color. Number 9, jaundice. We're staying on the whole bilirubin train here. I talked about how when red blood cells get broken down, bilirubin is the resulting pigment and it needs to be processed and eliminated by the liver. Now, this bilirubin, if your liver is diseased, will build up in the blood, and that can result in a yellow tint to your skin, which is called jaundice. It's a result of elevated bilirubin in your blood. This is quite a hallmark of liver disease. Now, it tends to be more common in advanced stages once your liver has started to scar and you have liver cirrhosis. And finally, number 10, unexplained weight loss or weight gain. Now, let's talk about unexplained weight loss, because this is always a red flag to pretty much any doctor. If someone is having unexplained, unintended weight loss, it can indicate a lot of things that we want to rule out. Liver cirrhosis, liver cancer, advanced fatty liver disease are some of those things. Now, this does tend to happen in more later stages of liver disease. In early stages of fatty liver disease, you might see weight gain actually, because as I mentioned, the risk factors, obesity, insulin resistance, poor diet, those tend to lead to weight gain. So that is usually what you will see in the early stages. But if you are advancing in fatty liver disease and it's becoming cirrhotic or scarred, your liver, that can actually lead to some weight loss. I would say if you have unintended weight loss for whatever reason, if you don't know what it's from, you should definitely go talk to your doctor and investigate, because it could potentially be a serious reason. Okay, I'm going to throw a bonus one here because this is an interesting one you want to be aware of. It's called hepatic encephalopathy, and it basically means brain dysfunction as a result of liver disease. So it can lead to changes in cognition, memory confusion, disorientation. So you can start seeing these brain effects because there's so much toxin buildup in your body and the liver just can't keep up. Your sleep can be affected. You can even have neurological symptoms like tremors, difficulty walking, instability, and even personality changes. So it can worsen mental health, depression, anxiety. So I can't emphasize enough, this is not a joke. This is one of those conditions that with good lifestyle changes, diet, lifestyle, exercise, all these things, you can make dramatic changes and reverse, ideally prevent, but you can also fully reverse this with the proper changes. This is a disease that can become really severe and lead to death. Not to scare you, but in the advanced stages, if you develop liver cirrhosis, or it can predispose you to liver cancer, and you might need a liver transplant. So this is a pretty serious condition that if caught early can be reversed. I will do a future video about how to reverse and treat fatty liver disease. Make sure to subscribe and give this video a thumbs up if you found it interesting and helpful. So make sure you join me on this journey so you can become the healthiest and best version of yourself. Let's do it together.